Thanks. Good morning, everybody, and welcome to our first aid webinar on the regulatory changes coming to the social services sector and all the sectors really in the province. My name is Tigran Baigorj, and I'm the CEO of the Community Social Services Health and Safety Association. I'm excited to have you all with us today as we explore the first aid changes coming to the OHS regulations starting actually on November 1st of this month. Before we get started, I would like to cover a few items. This webinar is being recorded. This webinar will be posted on our website shortly after this event. I invite all of you to sign up for our newsletter if you haven't already. And please know that all present will receive a certificate of attendance after the webinar. Before we get started, I want to acknowledge the unceded lands of more than 200 distinct First Nations in British Columbia. Myself, I'm calling in from the traditional territories of the Musqueam, Tsleil-Waututh, and Squamish First Nations. In our work and in our lives, we are committed to listening and learning, to truth and reconciliation, and to finding better ways of being on this land. We want to recognize the original caretakers of these lands, and as a learning organization, one that counts many Indigenous organizations as members, we always want to find better ways of integrating Indigenous ways with our health, safety, and well-being programs. Now, I know this is a little bit of a repeat, but if you're wondering, we are a small team. We currently have 4 members. Anna Lucia Mateus, she's our executive coordinator, taking care of our board and advisory panel. On our team, we also have Sancha Satne, our workplace psychological health and safety specialist. She is working with our CMHA BC partners on the People Working Well website and resources that are coming to that site. And also on the team, we have Teresa Barroso, part of the People Working Well team and working in partnership with CMHA as well. And she's our community engagement and research analyst. And before we move on, we do have some resources now posted on our website in regards to first aid. On the website, you'll find some really simplified templates to get you started, to start building out your first aid program. And I'm sure Marianne, our presenter today, will touch up on this. But I would say that the first aid program is really also the foundation of your claims management piece. And so if I'm wearing my employer hat, I would say that this is something you want to take a look at because it is a foundational piece of establishing your return to work and your claims management. And it is an important part of your health and safety and return to work programs that you want to establish in your organization. And moving forward, just want to highlight the next webinar that we have on our list. So that will be strategies for coping with winter blues. And it will be delivered by our very own Sancha Satne in partnership with People Working Well and CMHA BC. So generally twice a month, we are hosting webinars. Next month, because it is December and we got holidays coming up, we're only doing one. So please join us if you have the time and want to experience working with Sancha. And now, without further ado, I'd like to start the webinar and give our hosts an opportunity to introduce themselves. We have Marianne, our sectoral industry and program specialist, who sits on our advisory panel and is an important ally here in this work. Marianne, take it over. Thank you.
Thanks very much, Tigran. I appreciate that. As you said, I work as an industry and program specialist. Our department has recently been renamed to Prevention Programs and Services. It was previously called CES, which stood for Consultation Education Services, which sort of outlines a little bit more of the work that we do. Very specifically, I work with community social services, healthcare, and education throughout the province. So we're going to look at today the Occupational First Aid Regulation Amendment, which came into effect on November 1st. The few items that we're going to go through is the rationale and the key amendments. So why did we make the changes, what the minimum levels of first aid are, and how you can figure those out for your organization. A first aid assessment, the training and equipment requirements, which really comes down to drills and the certification, what those are going to look like, and the implementation timeline and key considerations. So as of November 1st, that is the sneak preview for the key timeline, but we also have some resources ready and available for you. So there's a background for this. The requirement for workplace first aid have been largely unchanged for nearly 20 years. So because of that, there have been some advancements in first aid training and equipment, and there's a new standard from the Canadian Standards Association known as the CSA. And so there were also some challenging rescue and transportation needs that prompted this update. So those are the reasons why we've made changes to the regulation. As an overview, they wanted to strengthen the requirements for 3A, the minimum levels of first aid. So some of the changes are a written first aid assessment. So the requirement to do assessment was already there. It's just been strengthened, the language around having it in writing. And there's a two-part duty when conducting the assessment, which I will go through with you. Employers need to consider any additional materials required in consultation with workers, and a written first aid procedures need to be available for your workplace. We also have enhanced transportation and equipment requirements for remote and less accessible work locations, and those are new definitions, which I'll also review with you. And part of the reason for these amendments is, as we mentioned, the CSA standards. So we've got CSA first aid kits, as well as training. And you can see they're delightful numbers to try and roll off the tongue. I'll just leave them there for you. I will give you a PDF of this presentation when we're done, so you can come back and look at it. There's also links at the end to a bunch of resources, and those will be live that you can click on to come to these. The key amendments. So they introduced something called workplace class, which has to do with location and accessibility, and there'll be a definition of remote as well as less accessible. The written first aid assessment, which I alluded to earlier, it's conducted in consultation with a joint committee or worker representative. We'll cover what all of those details need to look at. We also have requirements for annual drills, and the equipment is part of the guidelines in part 3, and that's around the first aid kits. And there is a first aid credential change, and that means the first aid training that you take, the names of those courses have now changed. So what is the two-part duty? Under the amended OHS regulation, employers have a two-part duty to establish their workplace first aid requirements by doing both of the following. So number one, you've always had to provide at least the supplies, facilities, and first aid attendance required by Schedule 3A. And now you also need to, in consultation with workers, perform a written assessment for each workplace to determine any additional equipment, supplies, facilities, attendance, and services necessary to ensure injured workers can be promptly provided with first aid and transported to medical treatment. So number 2 in particular, there were many incidents that happened over the years where first aid was to just call 911, and then it turned out that you couldn't reach 911, there was no cell service, or they were remote, or all sorts of things happened. So we're asking employers now to take a closer look at their workplaces to make sure that everybody can be provided with first aid. So what are those minimum levels? Schedule 3A has been enhanced. It is now several pages long. I have also got links at the end to that specifically. And it considers 3 workplace characteristics to determine your minimum levels for first aid supplies, facilities, and attendance. So all of that is outlined in the schedule. So number 1, you need the number of workers at the workplace. Number 2, you need the hazard rating assigned to the industry. And then number 3, the workplace class, which includes whether the workplace is remote. So it's now changed to more than 30 minutes surface travel time from the nearest ambulance station. It used to be 20 minutes from the hospital. It's now from the ambulance station. And there's something called less accessible, which means it cannot be safely accessed by ambulance, or it includes one or more hazardous work areas that cannot be safely accessed by ambulance personnel. So what does that mean? If you've got people on scaffolds for some reason or on roofs, the ambulance attendants can't climb up there to go and rescue the person. If it's a resource road that's radio controlled, then that would be another example. Probably not things that you would find in your industry as much, but if for some reason you go on a trip, you're out in the woods, these are things that you do need to consider for first aid. So to try and make this a little bit easier, these are the classes, and I've put a little chart here for you to find out which one is class 1, 2, 3, or 4. It's a little bit of a mouthful. So class 1 is basically not 1, 2, 3, or 4, and that's the definition, which is not my favorite way of defining things. So class 1 means it's not less accessible. And this is the wording that they have done. Unfortunately, it's been reviewed by legal professionals. And so if we have something that's less accessible, instead of calling it an accessible area, they have gone with not less accessible. So again, a bit of a mouthful, but not less accessible means that ambulance attendants can get there, and not remote. So very likely most of your urban settings, and that's class 1. And then you can see from the chart what class 2, 3, and 4 would also be. So the first aid assessment. Every workplace will now require a written first aid assessment performed in consultation with workers to determine the first aid equipment, supplies, facilities, and attendance and services necessary to ensure injured workers can be promptly provided the appropriate first aid and transported to medical treatment. As Tigran mentioned, on the CSSHSA website, they have an assessment that they have tweaked a little bit for your particular industry. We also have a fillable template that's available online. That link goes directly to it. We also are offering an interactive online tool, which means you go in and you can type in your information. It asks you the questions and then it will generate the PDF for you. This is a screenshot of that where the orange arrow is. That's how you find that particular link. And then at the bottom in the orange outline is the actual link that will take you directly there. So I've tried to make it as easy as possible. If you search interactive online tool for first aid, it doesn't pop up on our website, unfortunately, so it's not tagged very well. So this is why I gave this to you, hoping it's easier for you to find. So within this presentation, there are a couple of slides that are just right from the regulation, and you can tell that when there's a number in front of it, much like this one. So S stands for section, so it's section 3.16 and the basic requirements. So the employer must provide for each workplace, again, supplies, facilities, first aid attendance, and services required by Schedule 3A, and as well any additional equipment and supplies. So this is new to the regulation, and we're looking at making sure that all of the things that perhaps we can think about ahead of time are definitely covered so we can have prompt first aid and people can also be transported to medical treatment. It goes on to say for the purposes of complying, the employer must prepare a written assessment that sets out at least the following information. So the number of workers, you need that in order to find out how many attendants you need. The locations of workers, so where they're going to be within your work site, the nature and extent of the risks and the hazards of the workplace, the types of injuries that are likely to occur, any barriers to first aid being provided to an injured worker. So again, if they're working at height, if they're working somewhere where it's difficult to get to them, and if the time that may be required to obtain transportation and to transport an injured worker to medical treatment and the methods of transportation available. So some sites have to provide their own transportation. For most of your sites, you should be able to rely on the emergency health services from BC Ambulance, but it's always good to make sure, so you go through this assessment to make sure that that is indeed the case. And involving workers in first aid assessments. So section 316 also states an assessment under subsection 2 must be prepared, reviewed, and updated in consultation with the joint committee or the worker health and safety representative as applicable. So if you have over 20 workers at your site, you should have a joint health and safety committee. If you have between 9 and 19, you should have a worker representative. And if you have less than that, there should still be somebody within your work site who is responsible for health and safety. And those are the people that you would collaborate with for these assessments. So I went in and did a little bit of research on your behalf to help you with the minimum levels of first aid. They're determined by assessing those 3 factors that I had mentioned earlier. So the number of workers present at the worksite during a typical shift. If you go to the guideline, pages 10 and 11 of the guideline very specifically talk about how to calculate the number of people. So if you have people who are only there for part of the time, it gives examples on how to calculate those numbers. And that's the best information that I can give you. I can't give you examples for every scenario, but for sometimes when you have just 1, 2, or 3 people who are only there part-time, you count them as one person instead of all 3. So it gives you all that information. The next is the hazard rating assigned by WorkSafe BC for the purposes of defining first aid related requirements. So that is us. When you go in and look at it, for the 3 classification units for community social services, 766007, which is counseling or social services, it's low. 766010, life and job skills training is also low, and as well 766017, residential social services is also low. So WorkSafe BC has determined that all of those classification units have a low hazard rating. So you use that when you look at the tables. And then you have to look at the class of your workplace. So again, that's 1, 2, 3, or 4 that has to do with remote or less accessible or not less accessible. And then you use the schedules from there. I have a outline of the steps. So number 1, find your workers, how many workers you have. Number 2, You need the workplace hazard rating, which I've given you. It's low for all 3 of your classification units. And then you need to determine your workplace class. So again, how far away are you? Are you remote or not? And then are you accessible or not? And then accessible or not, less accessible. And then you use Schedule 3A to determine your minimum levels of first aid. That easy. So when you review your first aid assessments, the regulation says the employer must review and update the assessment under subsection 2 within 12 months after the previous assessment or review. So that means once a year. It doesn't have to be a calendar year. It doesn't have to be every January, but it has to be within 12 months from the previous one. And whenever a significant change affecting the assessment occurs in the employer's operations. So if you have significant changes, you now need to review your assessment, document that with a new date. What would significant changes be, perhaps, you're asking? They include changes to the maximum number of workers present at the worksite. So if you've made significant changes there, then you definitely need to review that. The class of the workplace changes. So again, around accessibility or remoteness. The nature and extent of the risks and hazard in the workplace changes through the introduction of new or different equipment, processes, tasks, or workplace conditions. So if you've had significant renovations, you've brought in new equipment, then you need to update your assessment. If WorkSafe BC updates the hazard rating assigned to the employer's classification unit, then you would also need to update. I can't give you any idea about how often that happens. To my knowledge, not very, unless we have some significant information that there's an increase in hazards in that particular CU. When changes, and the last one, when changes to barriers or routes are identified that may affect the first aid transportation response or the BC Emergency Health Services response or travel time. So if you're in a smaller community where your ambulance stations actually close down, they usually send out a notice to the community about that. In that case, you would need to update your first aid assessment to say how you're going to get people to help when they need it. So hopefully that doesn't happen. I'm really hoping that our healthcare system can be robust and stay operating at maximum capacity, but just be mindful that if you are aware of those changes, you need to make changes to your assessment. So aligning with the CSA standards, there's training and equipment requirements. So the written first aid procedure. So this is different than the assessment. Pardon me for one moment. So the requirements for written first aid procedures have been enhanced. So there's always been a requirement to have them. We want to ensure that procedures identify how workers will be accessed and moved if there are barriers to first aid, as well as location and method of emergency transport where required. Officers, when they do come and look at and do inspect work sites, especially for first aid, they will be looking at first aid procedures. We have found quite a few work sites, not necessarily within the community social services, but within the construction industry at the moment that have not had first aid procedures that were adequate. So please be mindful that this is something that officers look for. And within the guideline, there's also an outline of what those procedures should look like. So communicating first aid procedures to your workers, once you've got them established, the employer must post the procedures conspicuously in suitable locations throughout the workplace, or if that's not practicable, practicable means reasonably capable of being done. This WorkSafe is the only organization I've ever seen that uses this word, but you'll see it sprinkled throughout our regulations. So again, it just means if it's reasonably capable of being done. So if it's not reasonably capable of being done, then the employer must adopt other measures to ensure the information is effectively communicated to workers. If you have mobile work sites where people are working out of vehicles, then having a copy of the first aid procedures within the vehicle would be considered and adequate information that's been effectively communicated. So those sorts of things can also happen. The first aid attendant and all other persons authorized to call for transportation for injured workers must be trained in the procedures. We also recommend just keeping a copy of your first aid procedures with your first aid kits. That way, if anybody moves the first aid kit, they've got the procedures there and they're readily accessible when they do need to use the kit. We have drills for the new regulations. So it's in section 317 and it's part 4. So it says at least once each year and whenever the procedures change. So remember, when we're changing procedures or we're changing assessments, the employer must ensure that drills are conducted to ensure that the procedures are effective and that the workers, first aid attendants, and other persons referred to in subsection 3 are capable of fulfilling their roles and responsibilities. So we just want to make sure that everything is working properly. Please note with drills, you do not need to call the ambulance, and please don't call the ambulance. You just mimic that as part of your drill and assume that they will arrive in their regularly scheduled fashion. But drills are required annually whenever first aid procedures change. Just again, to make sure that the procedures are effective and that everybody at the workplace is capable of fulfilling their roles and responsibilities. So that's the reason why we're asking for drills to be conducted, just so you can test your procedures. And then hopefully if there's anything that did not work well, you find a way to correct it when it's not an emergency, so that in the event of an emergency, things flow well. There is a note in the guideline on page 28. Reviewing a real incident requiring first aid will not generally be considered an acceptable alternative to a drill, as this practice may discourage the identification of deficiencies and/or introduce privacy or other concerns for injured workers, first aid attendants, and employers. So even if you do have quite a few first aid incidents that are happening on a regular basis, that would not be considered a drill when you review them. So please make sure that you're doing your drills. And in order to prove that you're doing them, you need to document that it's been completed. So when do we conduct drills? Once a year, minimum, and whenever the procedures change substantively. So for example, a change in transportation methods. So if you were providing your own transport instead of relying on the emergency services and you've changed that somehow, make sure people understand how to use it. A change in protocol for summoning the first aid attendant if you've got a new communication method. Then you want to make sure everybody's aware of that. If there's a change in workplace class, and again, workplace class has to do with remoteness and less accessible, whether it is or not. So if you've changed that, then you need to do a drill. A change in the level of required first aid certification. We'll talk a little bit more about what that means, but it's the level of first aid attendance, so whether they're basic, intermediate, or advanced. And a change to the rescue procedures. So if you have any of those changes, you need to make sure that you're conducting a drill, again, to make sure everybody's familiar with it and it flows smoothly. So procedures and processes assessed during first aid drills. What are we looking for? We're looking for the ability to access equipment, supplies, and first aid facilities. Did that work well? The worker's familiarity with how to call first aid and the location of first aid equipment. How effectively the first aid attendant can be summoned, how effectively the first aid attendant is able to respond to both minor and serious injuries, how effectively an injured worker can be accessed and moved if there's any barriers present in the workplace. So if you need to get them somewhere where the ambulance can then take them, that also needs to be checked. And how effectively an injured worker can be prepared, otherwise known as packaged, and transported to an area accessible to BC emergency health services if required, and whether the first aid attendants are familiar with the documentation and reporting requirements. So there's always a first aid form that needs to be filled out, and the reporting requirements, making sure that everyone else in the organization who needs to know that there's an injured worker is aware of that. And then, as Tigran alluded to earlier about the return to work process, you need to make sure that it's reported properly so that as part of the claims management and return to work, we can get people back once they're healthy enough to do so. So the first aid and training has changed. It used to be called OFA, which stood for Occupational First Aid, and we had level 1, 2, and 3. They are now called Basic, Intermediate, and Advanced, and that's in line with the CSA standard, which means across Canada now, all of the provinces should be adopting these same first aid standards. And so that means you can move within the provinces a little bit easier. So the major changes are OFA level 2, or what was known as that, is now intermediate first aid. It went from 5 days down to 2 days, and that change is reflected in the Schedule 3A minimum first aid requirements. So we know that it's less training, but when you look at the requirements of Schedule 3A, that has been taken into account. Also really, really important for anybody who has already done their first aid training and they hold a level 1, 2, or 3 certificate, they have they don't need to be updated until they naturally expire. So they will be considered to be basic, intermediate, or advanced equivalents until they do expire naturally. And then once that happens, you would get the new training and it will be called basic, intermediate, or advanced. I hope that is clear. There has been a change in the first aid kits as well, and this is based on the CSA standards. So you can see the name change. Again, the CSA number is there. I will just let you look at that. Um, the most important piece of information that I can offer you around the first aid kits is please do not throw out your old kits. There's no need to do that. All you need to do is just update some of the items within the first aid kit to make sure that you're within compliance. So you can see with the level 1 kit, it's now in the basic kit. There's the requirement for a tourniquet and some PPE to be added in there. There are lists of the first aid kit requirements on our website as well, just to make sure that you can look at what you have, what you might need, and then get those items in there. We are also not cracking down, if that's a word I can use, on the sizes of bandages and the number of bandages. So if it requires a 2x3 bandage and you have a 1.5x3 and you've got enough, that's substantially close enough. So just be mindful, even though we do give very specific measurements for bandages, as long as the bandages that you do have are within a realistic size of that one, then there shouldn't be any problems with that. Band-aids do expire though. Please be advised, eventually the adhesives break down, so you may need to replace some bandages within your kits. What is the implementation timeline and some key considerations? So we started this a year ago. And moved forward. We developed a guideline, the draft guideline, we posted it for public feedback. The preliminaries was posted. The first aid assessment tools came out. We've done all of the training requirements and certification for the first aid training providers. They are now offering the 3 newly named basic, intermediate, and advanced first aid training. And we've also got an FAQ, which is frequently asked questions, and video posted on our website as well. And we have been doing some of these webinars just to make sure everybody is aware of all those changes and answer any questions. So as a summary, this is what has changed. So in the blue column, brand new, well, yeah, reviewing first aid assessments. So we had the requirement for first aid assessments, and now reviewing them is brand new. Involving workers in first aid assessments is also new. There are some EDI considerations in first aid programs that is outlined within the guidelines, so just keep that in mind. Communicating first aid procedures to workers is also new, as well as the drills. We have done substantive revisions, so quite a few revisions to the registered nurse in hospital settings, EMA license holders, first aid assessment, developing and implementing procedures. There's lots of changes around air transportation and equipment lists, and ETV, MTC industrial vehicles. So you are welcome to look at those if any of them are applicable. I didn't think that the air transportation would be, so I've left this out of the presentation. And the attendant needs to be fit for duty as well. And it was previously called medical prerequisites. So that has changed. And we are retiring the municipal fire departments and the automatic external defibrillator, or automated, sorry, within the regulation. They are covered within other sections of the regulation. So key considerations for November 1st. November 1st has passed, but there's still key considerations. So first aid certificates, they remain valid until they naturally expire. So you don't have to go out and get new retraining, but once the certificates expire, you do need to have the new basic, intermediate, or advanced training. First aid kits do not need to be replaced. You simply replenish or add additional materials in accordance with the CSA kit requirements. And again, we have lists on our website for what that is. The written first aid assessments need to involve workers and are required, and written procedures also need to be reviewed annually. So all of those things need to be reviewed. You need to document when you do that review just to make sure that it is being done. Drills are required annually or when written procedures change. Again, reviewing a first aid incident is not considered a drill. The final version of the guideline is now available on worksafebc.com. It has a lot of really great information in it. If you have any questions, I highly recommend you go there first. It does outline fairly well, I think, most of the information, and ongoing communication through e-news, WorkSafe magazine, and social media, as well as worksafebc.com. So those are the things that we have available for you. In terms of other things available, so our resources, the landing page for first aid requirements is there as a link. There's also quite a few videos now that encapsulate some of the information that I have given to you. They're watchable through YouTube and on our website. The FAQ, so the frequently asked questions, we have that document updated on our website. We have a backgrounder, again, why the regulations have changed and the reason for that. The hazard rating and CU descriptions, if you wanted to look up something else, there's links to go there and find them. And again, the 3 classification units for your particular sector, so the community social services, they are all low. I have looked those up for you. And assessment worksheets. So our first aid assessment worksheet, that's a fillable PDF is there. The CSSHSA on their website also has one. And we do have the fillable online tool. And I have given you the link earlier in the presentation for that. And then there's a link directly to the guideline as well. So that is the overview of the changes for first aid. Fairly quick. Do we have any questions? And I don't know if everybody is muted. If you want to put a question in the chat, and otherwise, if there's a way to raise your
Marianne,
hand.
I think that there was one question while
Okay.
you were talking about the drills. It's
Okay.
is this only a medical emergency drill, or what about any other drills?
No, so you're drilling for your first aid procedures, right? So your overall, you want to make sure that your assessment is adequate and that your first aid procedures are adequate. So it's not just a major medical emergency. You also want to test for something perhaps minor, a sprained ankle. Can you get the person to where they need to be? Can you call the first aid attendants? Does everybody understand what to do? Those sorts of things that you're testing. Does that answer the question? Hopefully.
And then so we have the Q&A. So if you have questions, you can enter them in there, or I think you can also go off mute and ask the question.
And so I'm going to just add to that with drills, you can do a tabletop drill. So for a major emergency, if you want to gather the people that you need to and discuss what the steps would be in that, you can also do some tabletop drills because sometimes it's really difficult to go through all of the steps on a site. But we do want to see that you are going through what a drill would look like and all of those steps. They were outlined on a previous slide, the things that we're looking for to make sure that you're testing your first aid procedures. Did I present so clearly that there are no further questions? Is that possible?
Thank you, Marianne. Yeah, and like I mentioned, and I provided the link in our chat, we do have some resources on our website. So one second before I go further, there's a question. First aid drills, does it matter if the emergency involves injured clients, or does it have to be injured workers?
Oh, so both. So there are a couple of different considerations. So with WorkSafe BC, when we look at our first aid requirements, it's around workers specifically. So there are other legislative bodies that deal with your clients. So you may need to take those drills into account. But for the purposes of WorkSafe BC, because we're dealing with workers very specifically, those are the first aid requirements that we're looking to make sure that we're meeting. So there, again, there's different requirements within the healthcare setting, social services, and schools. So schools, when we look at theirs, it's not about the students' first aid, it's about the workers at the school. So with community social services, yes, it's important to provide first aid for your clients, but that is not something that we have oversight over. Does that make sense?
Yeah. But the fact that now we're following the CSA standard around first aid makes it easier to kind of combine those two programs into one and take into account your clients and WorkSafe. But
I would hope so. And that's part of the reason why we've adopted the CSA standard. I do see about getting the slides. I will certainly send them to Anna and Tigran at the end, and you can use those.
I see another question here. So what level of first aid would you recommend for our employees in the community social services, emergency first aid, or occupational first aid?
So you would need to go through a first aid assessment. So there's 3 things that you need to do in order to figure out what kind of first aid you need. You need to know the number of workers. You need to know your hazard rating. And again, yours is low. And then you need to know what class of workplace you have. So again, it's remote or less accessible, those 4 different combinations. And then from there, you need to go to Schedule 3A. So once you've determined those 3 things, it will tell you which table in Schedule 3A you need to use. And that tells you what level of first aid training you need and how many of those first aiders. Does that make sense? Hope so.
I hope so. And if you have follow-up questions, you can message us via our website, and we can
Mhm.
have a one-on-one meet with your organization to discuss this further too.
Yeah. I do have, just for an example, I'll pull up. I have the minimum levels of first aid, so I will show you what that looks like really quickly. Should be this screen. Can you see that screen? Oh, no, I need to share it first. There we go. So can you see, this document is called, oh, I'm sorry for the scroll. It's called minimum levels or minimum first aid requirements. So table 3.1, it talks about class 1 workplaces, and it will show you how many workers you have, the hazard rating, and then what you need to have depending on those hazard ratings. So low, moderate, or high. Again, you would be looking in the low column. And then depending on how many workers you have, but you go to the next table. So if you're a class 2 workplace, it goes through the numbers of workers and the first aid requirements. So I hope that makes sense. Okay.
Marian, there's a question about how do these first aid changes affect workers working alone?
Oh, so excellent question. I don't know exactly what you're trying to get at, but previously there was some requirements for a person working alone to have an OFA level 1, just so that they could, or a personal first aid kit, so that if something happened to them, they could certainly take care of themselves. Again, that's something that should be addressed in the tables. I see, just as a quick glance, it talks about 2 to 5 workers. So just a single worker is not mentioned in the tables, which means that in that case, those tables don't cover a single worker. But part of your first aid assessment and your procedures should cover what that person needs to know to be able to take care of themselves. And you also need to have working alone procedures to make sure that if anything does happen to them, other people can come to their aid.
And then I see we have a number of questions in the chat. Let me go through some
Okay.
of them. Firstly, thanks for the webinar. During preparing our first aid procedure, I couldn't decide in the case of an accident on a 5 to 6-story construction site, would the ambulance crew typically use the stairs to reach the injured person, or would it be more appropriate for us to use a spine board or similar equipment to bring the injured person down while waiting for the emergency responder?
Okay. So there's 2 pieces to that one in particular. So it depends on the construction site itself. What does it take to get to those stairs? The ambulance attendants do have spine boards that are capable of going up and down stairs. Usually, it is best practices to, in the case of that, because sometimes there's specialized PPE required. You need eye protection or a hard hat in order to be on those sites. So you would want to make sure that you could get that injured worker to where the ambulance attendants could guaranteed be able to access them. So that would be my recommendation, is that you should make sure that you can get them to the ambulance attendants, just in case there's any of those particular requirements. Yeah, especially if you got open rebar or something on the way there, that's not something that ambulance attendants are supposed to be wandering through.
Another question we have is, our workers have emergency first aid for community care. Is this equivalent to basic first aid?
That's a really interesting question. We have something called certification services, which is a department in and of itself. If your provider gives their information, so whoever gave that training gives your information to certification services, they can determine whether it's equivalent or not. If your provider has not done that, then it will definitely not be deemed equivalent. So what our certification services people do is they go through all of the material, the training material that is given to the participants to make sure that it meets the requirements, and then they'll determine whether it's equivalent or not. So it is up to your provider to offer that information to us. It does take some time for review, and then we can let you know if it's equivalent or not.
How would we reach out to certification services? Is it
I
a,
can give you their numbers if you want, but if you just go to our website, you should be able to find their contact information there as well under certification services, but I can also provide that for you.
thank you, Marianne, yeah.
No problem. I'll just make a note.
Good reminder, yeah, that there's certification services. Next question was, at a health clinic where there are doctors and nurses present, would their level of training be acceptable to the board, basic or intermediate first aid attendant? Would the employer need a variance? And
Okay.
that's a good question, right? Because
That
there's
is a
changes to
great
health.
question. So there have been, and I don't know that I can pull it up fast enough in this moment, but there is some understanding or a letter of understanding between WorkSafe and some of the nurses, and very specifically in healthcare settings only, that their training, and I don't want to misspeak, but they have to have a certain level because there are different types of nurses. Their training would be deemed equivalent to first aid, so they don't need to go back and do first aid. But again, I would have to look up exactly which nurse it is, and it's only in certain healthcare settings, so it's not in all settings. And I know that can be a little bit frustrating, especially as a nurse when you've done all of that training and now you're working somewhere else, and you need to do a basic first aid course. But unfortunately, that is the way that the regulations are.
And Marianne, this is, I
Mhm.
think it's in the guideline, or is it in the
It
regulation?
should be in the guideline. It won't be specified in the reg, but it should be in the guideline. And I can also look that up for you and include that within the presentation. I'll do an addendum slide in there because we do have that information.
Please, yeah, because I believe it was only related to acute care, but I could be wrong. I think I saw
Yeah.
that in there because that
Mhm.
was a major point that
Yeah.
around the nurses and what was
Mhm.
previously allowed and not allowed. But
Yeah.
one more question I see is so I think this is related to the certification piece that you were talking about. So if a course is not deemed equivalent, that means it's not, or does it mean it could be but hadn't been confirmed? And
Yes, so it could be not confirmed yet. But again, it lies with the training provider and our certification services department to make sure that those are deemed equivalent. So very important to check with your provider to see if they have that equivalency. Or again, I will give Tigran and Anna the contact information for certification services, and they can get back to you with that contact, and you can reach out to them.
and
Where
the-
was that? Within the guidelines. Oh, so within the guideline, outlining the number of workers, it should be on I believe it's on page 10 and 11. Um, but it should be there. I don't have the guideline open in front of me at the moment, so it's very close to that. And if you also, the guideline is keyword searchable, so it's PDF. You can go into the search box and look for a number of workers. You could type something like that in, and it should take you to that section as well. But it should be around page 10 and 11.
and we'll yeah, we'll include the slides, we'll provide that.
Mhm.
There was a statement made. I don't know if we read the statement, if Marianne or Tigran can confirm if this is correct. There's a statement that says, we would call this a functional drill for the medical emergency drill. This can be something minor or major. We would during a functional drill ensure supplies are available, or even things like the meeting point during a fire drill is still adequate.
So it sounds like I'm not sure where the question is in that. It does sound like as a drill, you're looking for the correct things as a functional drill to make sure that everything within your programs are working properly. There is again within the guideline, and I had the slide that outlined the points, the things that you're looking for to make sure that your program and your procedures are covering within those drills. I'm not sure where that was, Anna, for me to be able to reread it.
It was sort of in the middle,
Is it
10:35.
in the chat or in the Q&A?
It's in the chat.
Okay. Cool.
Um, Now, I have one more question from
Mm.
it says, if I employ one worker, I would not be considered a worker myself in terms of calculating the number of workers, correct? I'm sort of a volunteer manager as a contract holder that pays workers.
Oh, that's interesting. Hang on.
That's a tricky one.
Yeah, where is that? Okay, so if I employ one worker, I would not be considered a worker myself. Okay. So I would go to the guideline just to double check that, because if you are still an employee of the organization, right? So you're a volunteer manager, contract holder that pays workers. That's a tough one. I don't know that I can answer that absolutely 100% correctly. If you would like to unanonymize yourself and give your contact information to Tigran, I can go in and ask one of our subject matter experts that exact question and then be able to get back to you with the information. Because when we talk about workers, we talk about all workers within the organization. So even management is considered under that. As a volunteer, you're very likely still considered an employee, right? Covered underneath the WorkSafe BC protections. So I would hazard a guess that you would be included in that as well. But again, if you're interested in having a more comprehensive answer, I can certainly contact our subject matter experts on that.
One more, would the local ambulance station be able to identify class non-accessible or remote?
So I would say don't call them. That is not it's not their job to do. But what you can do is if you just even our guideline recommends this, just go into Google and ask where your Google Maps, where's your local ambulance station from your address, and it will find that, and that determines your remoteness. The less accessibleness, again, in the guideline, it does give quite a few examples about places where BC ambulance is not expected to go. So again, resource roads, if they cannot get to somewhere within the work environment, so confined spaces, working from height, those sorts of things, if you've got something under construction and there's no flat, clear path, they're not expected to traverse hills and those sorts of things, or go very long distances where they would have to carry someone. So those are things that you would want to take into account in terms of, and again, it's not the responsibility of BC Ambulance to determine remoteness or less accessible. It's with the employer. So please don't call them with that question. They have a lot of other very important things to do.
Yeah, the less accessible one is a kind of a trickily worded, I would say. I think in general, like they're thinking mostly of other industries, like you're working in you're doing some confined space work, or there's some kind of like roof work or something that would be very tricky for them to access if somebody got injured in that specific sort of location of the work site. I would be confident to say that the less accessible piece doesn't really apply to our sector so much.
It shouldn't as much. So they're the big ones like excavation, scaffolding, those sorts of things. BC Ambulance is not expected to go there. If it is a regular house, BC Ambulance should be able to access that, or a regular workplace, unless you've got something going on that you cannot move people in and out easily, or if you have very strict PPE, so personal protective equipment requirements for a space. That if people needed hazmat suits or something like that, then BC Ambulance would not be able to get there either. It looks like we've got something.
And as Marianne identified, the remote piece is really easy. You go into Google Maps, just figure out where your next ambulance station is, and you can quickly determine whether it's remote or not remote. So I have another question. I think there's a long statement here. Do you see it in the
Yeah, I'm just reading through it. It's got some good information.
Please remember to read out the statement, or else people that are going to be listening to the
recording
won't know.
Okay, I will. It's a long one, so bear with me. Here we go. So emergency first aid community care, St. John Ambulance has this listed on their website. So St. John Ambulance says, this fast-paced one-day course meets the first aid requirements under the BC Ministry of Health, Community Care and Assisted Living Act. So again, different than the WorkSafe BC. This course also meets first aid requirements for the Canadian Labor Board or Labor Code Basic First Aid. Again, different than the CSA standard for basic first aid. Emergency first aid community care meets first aid requirements for anyone who provides care for infants, children, and/or adults in licensed adult care and child care facilities. It is also suitable for federal government employees, which WorkSafe BC does not have jurisdiction over, home care providers, coaches, and care support workers. This course now offers opioid poisoning and administration of naloxone, both intranasal and intramuscular. This course also meets first aid requirements for Canadian Labor Code Basic First Aid, but is not recognized as equivalent to WorkSafe BC Occupational First Aid Level 1. But we're looking for basic now because we're no longer level 1. And successful completion of this course also includes a CPRB and AED certificate. So it was not equivalent to OFA level 1, which would tell me it's very likely not equivalent to basic yet, but it possibly could be. Again, it would need to go to certification services to look at that. And I know that's a really frustrating answer because it's very likely that some of your workers already have this particular course. If you're willing to give your contact information to Anna or Tigran, I can also bring this to our subject matter expert and find out within certification services whether this course has been brought forth to look at getting an equivalency.
You know what? I can also email certification services to inquire about the specific course. So seeing it here in the chat now, I know where to reach out. Thank you.
Right. Okay, are there any other questions? Oh, possibly in the Q&A?
There's one in the Q&A at the bottom there. Would a
Okay.
local park be considered less accessible?
I'm going to throw it out in the dark. I don't feel that it would be. That doesn't sound like there's any reason why BC Ambulance couldn't get to a person within a park setting, unless, of course, you've gone down into a ravine or something like that, and cross a river and there's no bridge. That would be something that would prevent them from getting there. But just a regular local park, BC Ambulance responds to those sorts of calls on a fairly consistent basis. That shouldn't be a problem. Anything else I can possibly? Oh, what
So I'll follow up on the emergency first aid community care. So on St. John's Ambulance, I'll email certification services and I'll provide the answer to, I guess, probably put it in the next newsletter so that it's clear for everybody who's receiving in our sector. So thank you for those great questions today. And thank you, Marianne, for presenting on the first aid changes. Really appreciate your time. And everybody that's been part of it. So if you have any questions, we'll email out the webinar slides later on, and we'll email some of the answers in our next newsletter. So thank you everyone for participating. And with this, we're gonna close the webinar for today, and have a great rest of your day and holidays if we don't see you again this year.
Thank you.